Hello and welcome to the Protective Factors and Coping Skills webinar. I'm Cabrini Rivera. I'm the school counselor at Benito Martyrs Memorial School, as well as a school-based behavioral health clinical intern. So let's talk about some of the things we'll be discussing during our presentation today. So first, we're going to talk about what is mental health. Then we'll go in and we'll discuss risk factors versus protective factors. We'll continue our discussion by um, learning a little bit more about the effects of COVID-19 and what are some protective factors for students. We'll be practicing some coping skills today, and we'll finish off today's presentation with the 5 ways of well-being. So let's go ahead and get started. So first of all, what is mental health? Well, mental health is our emotional, psychological, and social well-being. Now, this means that it affects how we think, how we feel, and how we act. Mental health is important at every stage of life. And just like physical health, everyone has mental health. So this means sometimes we need to do things to make sure we keep ourselves mentally healthy. I do have a short video for us to watch where we'll be learning more about mental health.
We all have mental health. It is just as important as physical health. It is not only about mental illness or mental disorders. This is just one part of a bigger picture. It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum, so that they're able to reach their full potential and live satisfying lives. The World Health Organization describes mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships. We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with a person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting, and are associated with increased disability. They significantly have an impact on daily functioning and frequently interfere with family, social, and work responsibilities. Fortunately, there are effective treatments and evidence-based interventions available that aim to help individuals understand and cope with symptoms of mental illness. However, very few people with mental disorders access existing treatment services. This may be due to barriers such as the stigma attached to seeking help, the lack of understanding of mental health problems, uncertainty of how to get help, or the fear of disclosing mental health problems. Research shows that stigma remains one of the biggest factors preventing people from seeking help early for their mental health problems and getting the appropriate support they need. It is important to acknowledge that we all have mental health and have a personal responsibility to learn how we can improve and maintain our well-being in order to lead meaningful and satisfying lives.
Okay, so just like the video mentioned, right? So some things that can affect our mental health include biological factors. This means our genes, our DNA, or our brain chemistry. Sometimes even life experiences such as trauma or abuse, and family history of mental health, right? And all of these things fall into, all of these experiences, all of our experiences fall into 2 categories, right? They're either risk factor or protective factor, right? So risk factors are elements in a person's environment that increase the chances of them engaging in health compromising behavior or developing a mental or substance use disorder or not recovering from challenging events such as traumas or natural disasters. And on the other hand, we have our protective factors. And these act kind of like a buffer against the risk by either reducing the impact of the risk or by changing the way that a person responds to those risk factors. And building protective factors, building protective factors can help to increase a person's ability to bounce back. This is also known as resiliency, that was also discussed in the video. So if you look down at the bottom right, we have two different symbols. We have our warning sign, which is our risk factors. And then on the right, we have our shield, which are our protective factors, right? So our risk factors, um, our risk factors are reliable predictors for alcohol and drug abuse, antisocial behavior, youth violence, school failure, anxiety, and depression. Now, these protective factors are meant to be buffers against those risks, right? And increase the chances that we'll be able to experience positive life outcomes despite experiencing these risk factors. Now, these factors exist at all domains, and we can see it throughout development. So let's discuss some of these risk factors in detail, what that looks like at different levels of development. So on the left, we see we have our risk factors, and then on the right, we see that we have the correlating protective factors, right? So we kind of see that they're on the same level, and if we look at the risk factors on the right, sorry, on the left, we see that it correlates to protective factors on the right. So if we're able to build protective factors on the right, they help protect us against those risk factors on the left. So at the child level, right? So at the individual level, we have, for risk factors, we have difficult temperament, low self-esteem, negative thinking style, and the protective factors on that level are easy temperament or having good social emotional coping skills or an optimistic coping style. Now, if we move down to the family level in our risk factors, we have family disharmony or instability or even breakups, harsh or inconsistent discipline styles, or a parent or parents with mental illness or substance abuse. Now, on the right, our protective factors, we have family harmony and stability, supportive parenting, and strong family values. At the school level, for our risk factors, we do have peer rejection, school failure, and poor connection to school as risk factors. But on the other hand, if we're able to build positive school climate that enhances belonging and makes our students feel connected, it is a protective factor against those risk factors. Now, life events. If a person experiences a difficult school transition or the death of a family member or emotional trauma, those can be risk factors. But protective factors we have on the same level are involvement with a caring adult and support available at critical times. So being able to utilize support services that really cater to those needs when we are experiencing life events that we might need a little bit more support with. Now, our last one at the bottom is our social interactions, right? So risk factors include experiencing discrimination or isolation, having a socioeconomic disadvantage or lack of access to support services. And our protective factors are participation in community networks, access to schools, access to support services, economic security, and a strong cultural identity and pride, right? So at the bottom, you see it's kind of like it's a balance, right? Or a scale. Okay, so if we experience more risk factors than protective factors, or if there are more risk factors present in our environment, then we have a higher chance of experiencing um, these, negative life experiences. But on the other hand, if we're able to add more protective factors to the scale and we're able to kind of balance it out, it increases the chances that we'll have positive life outcomes, even if those risk factors are present. So we have to kind of find that balance and build positive factors to combat the risk factors. So why is it important that we should learn about risk factors and protective factors? Well, first of all, students who have more risk factors than protective factors might require more support or interventions to help them cope with difficult situations. And like we were talking about the balance, right, or the scale, by increasing protective factors, we increase the likelihood that a person will experience healthy development and positive life outcomes despite experiencing great adversity. Now, let's learn a little bit more about how this connects to our pandemic experience. Now, the pandemic has been a traumatic experience for many of us, and this includes our students. So, in this video that we are going to watch, I want you to kind of think about what are some of the things or examples that are being said in the video. Are these things that you relate to or things that you've heard other people talk about, right? And when it comes to the coping skills, are these any things that you've tried to implement into your own self-care?
The current challenges brought about by COVID-19 for people all around the globe are unparalleled and have caused fear, anxiety, and uncertainty for so many of us. We are all going through this together, and it's important to understand that you're not alone in how you're feeling right now, and that there are practical, healthy ways to cope with these emotions. The COVID-19 pandemic has created unprecedented change and a need for a response from everyone around the globe. Many of us are worried about our loved ones and our livelihoods, and there is no one right way to cope with what we're experiencing. Remember, however you're feeling, there are others that feel the same. You are not alone. Here are a few voices of people struggling to cope during this time.
Some days I'm okay. I'm doing my best to adjust. But yesterday, I couldn't stop crying. This all just seems so unfair, and I feel so angry that this is happening to us. I'm struggling to care for my kids and work from home at the same time, and I'm worried about my parents' health. I watch the news and it just seems so hopeless. I don't know how to keep it together.
I feel so lost and sad. So much has changed. I used to have dinner every week with my family, but now I can't be in the same room with them. I really miss them.
I'm missing out on my prom and my graduation. I've literally been looking forward to these things my whole life, and I'm heartbroken.
With everything going on now, I just can't stop my thoughts. And physically, my chest hurts, and I can't breathe. I get nauseous thinking about what could happen to my family and my friends.
Before this happened, I used to worry all the time about getting sick. Now that worry has turned into absolute terror. My heart races every time I have to go to the store. What if I bring germs home with me? I can't stop washing my hands.
No matter how exhausted I am, my sleep is still terrible. I just keep picturing all the things that could possibly happen. Will I ever get a good night's sleep again?
I've been through so much already. I don't know how I'm gonna deal with this too. My flashbacks are getting worse and worse.
Honestly, I feel like I'm more comfortable in times of crisis. I'm not sure why I don't feel as upset as everyone else does right now.
I don't know when or if everything is going to get back to normal. I feel like the weight of the world is on my shoulders. How many people are going to be affected? What does this mean for me and my family?
We've just heard some of the ways people are being affected by the COVID-19 situation. Here are some things that are helpful in building resilience during times of crisis and intense stress. There are a lot of things outside of our control right now, which can be scary. By focusing on the things we can control, we can refuel ourselves and become more grounded and able to focus and cope with all of the things we can't control. One of the most important actions within your control is to follow CDC guidelines to reduce your chance of being exposed or passing the virus on to others. Use social support. No one should go through this alone. There is absolutely no shame in talking about what you're going through with your friends and family, and it's important to be there for others too. Video chat and phone calls are a great way to stay connected. Prioritize self-care. Staying on a regular schedule, exercising, eating a healthy diet, keeping a sleep routine, and taking time to meditate or pray are all important, now more than ever. Be gentle with yourself. During times like this, you will have good days and bad days. Your emotions are most likely heightened at this time. Try not to compare your life to what you see on your friends' social media feeds. There is always more going on behind screens. Helping others can bring joy and gratification. Do what you can to help others, even if it's something as simple as lending an ear or making someone smile. Be kind to the people around you, especially the folks who are still out working to ensure we all have what we need. If each day feels like an uphill battle, it may help to seek out professional support. To continue helping during this time of social distancing, many mental health providers are using telemental health in their practice. If you can't afford therapy or need to talk to someone right away, you can call the Suicide Prevention Lifeline 24 hours a day at 1-800-273-8255. You are not alone in how you are feeling. There are things you can do and resources you can use to cope during this challenging time. Check out our library for more videos to learn more about mental health, dealing with isolation, and ways to cope. We're all in this together.
Okay, so listening to that video and some of the experiences that were shared, I'm sure these are things that we've not only heard from our coworkers or our family members, maybe they're things that we've thought ourselves, but with the example about prom and graduation, right? These are also things that are affecting our students. So that's why I think it's really important for us to know that our students are experiencing this traumatic event right along with us. And some of the ways that we can help them is by building protective factors to help build resilience in them, right? Especially during this COVID-19 pandemic, because this pandemic, along with the social and the economic stressors that have accompanied it, can really affect the development and well-being of children. And coming with that, going along with that, children may not be able to receive supports they need while community services are limited, especially during some of the lockdowns, or maybe if they are themselves quarantining and they're not able to, go and seek those services. They are also in contact with fewer adults that would usually have direct contact with them, such as in the school setting, right? That's how we're able to identify what needs our students have, or maybe if there's something going on in the community or at home that's been affecting them. We usually use those in-school observations, and with the pandemic, it's a little bit more difficult, especially if they are not one of our online learners. So what are some things that we can do, or protective factors that we can build to help increase this resilience in them? Well, the first one is sensitive and responsive caregiving. Now, having access to a sensitive and caring adult can drastically help children recover from a traumatic event, right? And this looks like parents spending quality time with their children and staying connected with family and friends, even if from afar. The second one is meeting the basic needs. So ensuring that families, as well as their children, have access to basic needs such as food, shelter, clothing, medical, and mental health supports is so imperative. And I think it's really great. There have been, outside of the pandemic, right, there have been a lot of events in the community that shed some light on some of the needs that a lot of our families are lacking. Right, so I'm glad that GDOE has come up with a way to provide food. The government has been working on providing shelter to our homeless population. I've seen a lot of drives calling for clothing donations or supplies to help families that are in need. We're really trying to rally around each other as a community. So what else does this look like? This looks like helping families identify and connect with appropriate services to provide these basic needs, and also reassuring families that asking for help shows strength and resourcefulness. It's not a sign of weakness. It's a sign of strength to know that, this is something that I need. Where can I get this help? And I think that's something that we need to when we make these connections with our families at our schools, that we're able to encourage them to ask for the help that they need. So number 3, right, we have emotional support for children. Now, everyone adjusts to changes differently, especially during a pandemic. And emotional and behavioral changes in children is not unexpected, right? You know, we've all had the world kind of turned upside down on us. And it's not surprising that some children may have a really difficult time adjusting to this change. Now, strong emotional support from adults and the community can really help children to adjust. And some of the things that we can do is to use the 3 R's, which is one of the other webinars in our series. And the 3 R's are reassurance, routines, and regulation. The next one is to facilitate family access to appropriate support services. You know, if you know that you're a student or maybe even your child is in need of some support for their emotional behavioral changes, you know, what are some community resources that we can utilize, or even school resources? Number 4 is support for caregiver well-being. Now, we can't pour from an empty cup. So when the needs of parents and caregivers are being met, children are more likely to receive this sensitive and responsive care that we mentioned in number 1. Now, what does this look like? This looks like parents or guardians or caregivers taking a break from work or caregiving in order to address their own self-care, right? We need to take care of ourselves first before we're able to take care of others. This also looks like connecting parents or caregivers with support if they're struggling with their physical or mental wellness, right? So what are some community resources or school resources that we can connect these parents to so that they're able to take care of themselves and in turn be better able to take care of the children they're taking care of? And number 5 is social connectedness. So building positive social connections are important for both children and adults, right? As humans, we are social beings and we really we crave connection. And during this time, students have less access to mandated reporters who would be in charge of ensuring that if there are issues coming up either at home or in the community, that those issues are being addressed. Now, what does this look like? This looks like spending time with family and friends, whether online or in public, while following proper social distancing guidelines. It also looks like offering regular opportunities for students and families to connect virtually. You know, I know that there are some teachers that maybe start their Google Meets a little earlier so that students are able to just talk to each other and connect with their classmates. Or maybe some teachers are having some sessions that aren't, you know, of course, aligned to maybe a standard, but you know, the real want is to provide that connection to their peers. Now, how does this tie into coping skills, right? So not only do we want to build these protective factors, but we also want to build coping skills, which are tools and techniques that you can use to help you handle difficult emotions, decrease stress, and to keep yourself grounded. Now, being grounded means being able to stay in the present instead of being knocked off balance by your emotions, including emotional memories or even fears. And these strategies can also help you to detach from your inner emotional discomfort by being more aware of the physical world, right? So detaching our emotions or things that are maybe clouding our vision or things that are really blocking our mind, right? And focusing on the physical world of the here and now. And this is something that we call mindfulness, right? Being present in the present moment. So we are going to be practicing some of these different techniques or skills. Just find a comfortable place if you want to be sitting or standing, totally up to you. We will be having some guided technique practice. And our first technique is called diaphragmatic breathing. Sometimes they're also called belly breathing, and this involves engaging the stomach, abdominal muscles, and your diaphragm when breathing. This technique helps the lungs fill with oxygen more efficiently and helps us to control our breathing, which is something that might be associated with, you know, high levels of stress.
we can use our bodies to change how we feel. This exercise will teach you how to raise your energy and face your day. Close your eyes or keep them open. Have fun with it. Sit tall. You can be on the ground with your legs crossed, or sitting at the front edge of your chair with your feet flat on the floor. Let your arms hang down at your sides. Open and close your hands a couple times to warm up your body. Now turn the palms of your hands so that they're facing forward and stretch your fingers long. Keeping your arms straight, slowly float them up from your sides. Feel how wide your hands can reach, to the side and then up. Reach a little higher if it feels okay for your body. Now let your arms come down and return to your sides. This time, if we match our breathing with our movement, it might help us to feel more alert, calm, more energized, and in control. Notice how you feel when you add your breath to your movement. Turn your palms out and reach wide for a bigger rainbow. Fill with air the whole way up. And if you need to take another breath at any time, go ahead. Do that. It's all good. Once your arms are up, go ahead and exhale. Relax up there. Enjoy the rainbow. Your rainbow has faded away. Let's make another one as you come down. Breathe in to get ready. Breathe out and see the rainbow form as your arms float down to your sides. Let's do that 2 more times. Arms go wide and up with your in-breath. And the arms come down with your out-breath. If possible, stand up for your next rainbow breath. Rotate your palms out. Raise your arms up slowly with your in-breath, reaching wide and reaching tall. Let your arms come down with a slow exhale. Maybe try one more on your own. Your eyes can be open or closed. It's your choice. Enjoy the rainbow that you've created.
Our next technique is something called 5 senses. So we're going to be using our 5 senses to help keep us grounded in the present moment and practice mindfulness.
Kia ora, I'm Lizzie, an educator from Auckland Zoo, and today I'm here to share with you a nice mindful moment using your 5 senses. Sometimes it feels like my brain is racing at the speed of a cheetah. So today I'm going to show you a really nice, easy way to slow down into the moment using your 5 senses. So to start off, we're just going to take a couple of really nice big belly breaths. So you're going to breathe in nice and slowly, and then let that go with your exhale. We're going to be using our first sense. We're going to be using our eyes. So what are 5 things that you can see around you right now? There might be things that are up nice and close, or maybe they're really big things, or maybe they're slightly harder to see and you have to look a little bit further. From where I am at the moment, I can see some ferns in the ground. I can see my dog waiting patiently while I do this video. I can see the clouds in the sky, an orange ribbon in a tree, and some tree roots coming up from the ground. So what can you see around you at the moment? Great job. Next, we're going to use our sense of feeling or touch. So what are 4 things that you can feel or touch around you at the moment? For me, I can feel the clothes on my skin, I can feel the ground that I'm standing on, I can feel the cool air as it goes past my face, and I can feel the leaves that are on the trees nearby to me. So what are the things that you can feel or touch right now? Next, we're going to find 3 things that we can hear. So listen out, and what are 3 things that you can hear around you right now? I can hear some of the birds up in the trees. I can hear the sound of traffic quite far away. And I can hear the wind rustling through the branches. So what can you hear right now? All right, time to smell. So what are 2 things that you can smell right now? If you can't smell anything, you could think of your favorite smells. For me right now, I can smell the grass. It's all wet after we had some showers earlier today. And I can smell the scent of my lip balm that I put on my lips earlier. So what are 2 things that you can smell right now? All right, last one is your sense of taste. So what's 1 thing that you can taste right now? Maybe it's the taste of the last thing you ate. Or maybe like me, you can taste the toothpaste from when you brushed your teeth this morning. So right now, what's 1 thing that you can taste? Great job using all 5 of your senses, just like animals do. So check in with yourself now. How are you feeling? Do you feel nice and calm? Remember, you can do this exercise anytime you need to slow down and come into this moment. Have an awesome day.
Our next technique is called square breathing. So we're going to go ahead and watch this video, and it'll talk a little bit about the benefits of square breathing and how we can use this to combat our stress and anxiety.
This next grounding activity is called square breathing. And square breathing can be helpful for a couple of reasons. One, because our breath is connected to both the part of our nervous system that we can control and the part of our nervous system that is automatic. So it helps us access that calming part of our brain kind of in through the back door. The other thing about square breathing is if you practice it with varying lengths of breaths, then you can practice putting yourself into a slightly anxiety-provoking situation, which is being out of breath. But you're doing it intentionally in such a way that something that would normally be anxiety-provoking or uncomfortable becomes something that you can handle with willingness. So you are basically converting something that might have been stressful into something that is very comfortable. And that trains your brain to believe that you have the ability to convert something that's stressful into something that's beneficial for you. So let me just explain square breathing really quickly. So with square breathing, you imagine yourself breathing along a square. So you imagine yourself starting at the top right corner of the square, and you imagine yourself breathing in for 4 seconds. And then you imagine yourself holding that breath for 4 seconds. And then you imagine yourself breathing out, so exhaling for 4 seconds. And then holding that air out for 4 seconds, and you're back to the top of the square. And you repeat that 4 times. So breathe in, 2, 3, 4. So you're breathing in that whole time, holding it for 4 seconds, breathing out for 4 seconds. You're exhaling for 4 seconds, and then you're staying without breath for 4 more seconds. So just like that. When you exhale, you want to have all the breath out that you can have out. So you want to be completely out of breath. When you're done with your inhale, you want to be completely full of breath. And the other 2 are the process of getting in and out. Now you can lengthen the amount of time that you're doing these inhales and exhales and holding. So you can lengthen it out to 8 seconds or 10 seconds or 16 seconds. But when you lengthen the amount of time that you're out of breath, you're going to cause your brain to panic for a little bit. And that's where you can kind of challenge yourself to increase your comfort with being out of breath. So really, there's two ways to do this activity. The first way is to just stay at 4 seconds. Breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, hold for 4 seconds. And that's just going to be kind of naturally calming because it's creating a rhythm. And the other way you can do this is to challenge yourself to lengthen the amount of time you're holding that breath. And that's going to be a little bit more of a mental challenge that creates more resilience. So as you do this activity, just watch yourself and pay attention to the emotions that come up. So paying attention to your breath is going to help you stay centered and grounded while various emotions go through you. I hope this video was helpful. Thanks for watching and take care.
Our next technique helps us to focus on the present by focusing on the here and now. And this helps us practice mindfulness, which can decrease stress or worry. Now, mindfulness helps us open up and address our emotions, and we're also able to see things from a different perspective. So the whole point of mindfulness is to keep grounded in the present moment, and this allows all those things that are causing us stress or worry to be kind of pushed to the background so that we're able to focus and ground ourselves and return back to a relaxed state. So let's go ahead, we'll do this activity together. Again, find a comfortable position to sit in, and we'll be guided by the video.
This exercise will teach you how to gain control of your stressful energy when it gets too high to handle. Close your eyes, listen, and follow along. Or keep your eyes open and follow along that way. It's up to you. Sit tall. You can be on the ground with your legs crossed, or in your chair with your feet flat on the floor. Now imagine that you can look up and see the sky. And up in the sky, way up in the sky, is a balloon. If you'd like, you can choose a color for your balloon. Keep the picture of the balloon in your mind. The balloon's string reaches all the way down to your hands. Hold on to the string. Imagine that you can feel the pull of that big balloon. Imagine that the wind pushes it from side to side. Or imagine that the wind actually tries to pull the balloon higher into the sky. Maybe you can feel the gentle tugging of the string in your hands. Now try to bring your balloon down. Be careful to go slowly. You don't want the fragile string to break from pulling too hard or too quickly. Take your time. Imagine that you can gently pull the string, hand over hand. The string collects in a pile at your feet. Hand over hand, pull after gentle pull. The balloon appears to come closer. It might even become easier to bring it down in your mind as it gets closer to you. Keep bringing it down, closer and closer. Some other strings might be longer or shorter than yours, and that's okay. Just bring it down at your speed. Focus on your balloon. Keep bringing it down. Your colorful balloon may now be within your reach. Pretend that you do not need to use the string anymore. You can actually hold the balloon between your hands. Notice if you can feel the balloon in your hands. Be gentle. Imagine that with your next out-breath, you can open your hands and release your balloon. Let it go. Notice in your mind where it goes. It could be different for everyone. Just remain still for a few more moments and watch your balloon drift away.
Relax, think positive, and click here for more mindfulness exercise.
All right. And our last technique that we'll be going over today is called progressive muscle relaxation. So, in this exercise, you're going to tense a group of muscles as you breathe in, and as you relax, you breathe them out. And usually, you work on muscle groups in a certain order, starting from your feet all the way to the top of your head. And this exercise is a little bit different. But when your body is physically relaxed, you can't feel anxious. Right? And that's the whole point of this exercise to help relax our body and then, therefore, help us to calm our stresses or anxieties. Now, practicing progressive muscle relaxation for a few weeks will help you to get better at this skill. And in time, you'll be able to use this method to help you relieve stress. So, again, find a comfortable position. We're going to practice this technique together and follow the video.
Melting, melting, melting. We all have those moments when we freeze. We can't move, we can't think. But with practice, we can get good at melting that frozen feeling. Let's freeze up and then melt. Stand up in a spot with a little space around you. Cross your arms and hold your shoulders with your hands. Carefully tuck your chin down and in. Tighten as many muscles in your body as you can. Let your body be frozen, like an ice statue. Feet tight, legs tense, belly tight, shoulders up. Now, even make a frozen face. Close your eyes, your mouth, your jaw, tight. Feeling frozen? Really still? Now, little by little, begin to melt. Let your chin stay low as your face softens and melts. Your jaw opens slightly, your eyes blink open, just a little. Your mouth and cheeks melt and feel soft. You're melting. Let your shoulders melt and go down. Hands let go. Arms glide down to your sides, melting. Let your legs melt too. Soften and bend. Melt. Try to melt all the way to the floor. Down, down, down. Let yourself be a blob, a puddle on the floor. Melted all the way to soft. Exhale long. Once frozen and tight, and now melted, a little more at ease. Let's do it again. This time, choose your own frozen statue. Be creative. Freeze your arms. Freeze your legs. Freeze your face. Make a funny face if you'd like. Freeze there. Tighten. Freeze, freeze, freeze. You're frozen. Close your eyes or keep them open. Stay frozen for just one more moment. Ready to melt? One icy part of you at a time begins to melt. Face, eyes, jaw, head, chin goes down, shoulders drop, fingers soften and droop, hands too, arms float down. You are melting. Let your legs allow you to melt down to the floor. Melt, 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 droop, settle, and rest. Melted. Try to feel at ease here. Soft. Check in on your body. Is any area still frozen? Notice that tightness. Melt it if you wish. Rest here. Breathe. Eyes are open or closed. Next time you feel frozen, in your mind or in your body, try to melt it away.
Okay, so I hope that you were able to feel relaxed while doing those techniques. It's these techniques can really be helpful in relieving stress and helping us keep grounded and practicing mindfulness. And I would encourage you to try all of them and see which ones work best for you, which ones are most comfortable for you, and practice those and try to work them into your self-care. And we're going to be finishing off today's presentation with the 5 ways to well-being. So these are 5 ways to boost your mental well-being. And I hope that we find different things to help us.
Our mental health is important. By looking
And we're going to finish up today's presentation with a video that will talk about the 5 ways to well-being. And these different strategies can really help boost your mental well-being. And I hope you find some things that you might want to incorporate into your own self-care or your day-to-day to help you cope better with whatever's been going on, whether it be the pandemic or additional stressors that are happening.
Our mental health is important. By looking after it, we can feel happier, more positive, and are better equipped to get the most out of life. Research shows there are 5 simple things we can do as part of our daily lives to boost our mental health and well-being. These are called the 5 ways to well-being. Connect. Connect with those around you, with family, friends, colleagues and neighbours. Look to spend meaningful time with people each day. Instead of sending an email, talk to someone. Speak to someone new. Ask how someone's weekend was and really listen when they tell you. Arrange a catch-up with friends. Join a club or group of people who share a common interest. Put 5 minutes aside to find out how someone really is. Think of these connections as the cornerstone of your life and invest time in developing and strengthening them. Building these connections will support and enrich you every day. Be active. Look for ways to be active every day. Go for a walk or a run. Step outside. Stretch. Cycle. Play a game. Do some gardening. Dance. Most importantly, discover a physical activity you enjoy and that suits your level of mobility and fitness. Being active every day causes changes in our brain, which can positively affect our mood. Exercising makes you feel good. Take notice. To take notice is to be present in the here and now. Pay attention to the world around you, nature, people, your thoughts and feelings. Be curious. Catch sight of the beautiful. Remark on the unusual. Notice the changing seasons. Savour the moment. Becoming more aware of the present moment and reflecting on your experiences will help you appreciate what matters to you. Keep learning. Keep learning is about learning new skills and information about topics that interest us. We can keep learning by trying something new, rediscovering an old interest, signing up for a course, fixing a bike, taking on a new responsibility at work, learning to play a musical instrument, trying a new recipe. Set a challenge you enjoy achieving. Learning can make you more confident and boost your self-esteem. It can also be fun. Give. Giving is about small acts of kindness for other people, whether that be your time, patience, words, or a smile. The smallest act can count. Do something nice for a friend or a stranger. Thank someone. Smile. Make someone a cup of tea. Sign up for volunteering. Donate to charity. Offer to help someone with a project. Ask a friend or someone you work with how they are and really listen to the answer. Giving back to others can create positive feelings and help us feel more satisfied with life. Seeing yourself and your happiness as linked to the wider community can be incredibly rewarding and create connections with the people around you.
Okay, so I hope that the techniques and the tips that we discussed, by working them into your day-to-day or, practicing them can really help you to decrease your stress or keep you grounded so that you're not overcome by worry. Now, if those aren't helping and you feel like you're in need of extra support, what are some things that we can do? So first of all, with the Guam Department of Education, if you believe that you or a student is in need of further support, please contact your school counselor or the district school psychologist for a social and emotional screening. Now, the Guam Behavioral Health and Wellness Center and the Guam Crisis Hotline, the numbers are provided here on the screen. Those are both really good resources as well. If you would like to engage with community resources. Another option is to talk to your healthcare provider about practitioners that people in private practice. Let's try that over. So if you feel like you're in need of extra support, right? If you're including these techniques and some of these tips into your everyday life and you still feel like you need more support, what are some things that we can do? First of all, with the Guam Department of Education, if you believe you or a student is in need of further support, please contact your school counselor or the district school psychologist for a social and emotional screening. The Guam Behavioral Health and Wellness Center and the Guam Crisis Hotline, the numbers are provided, are both really good community resources as well. And if you feel like you would like even more support or maybe you would like a little more confidentiality, feel free to reach out to your insurance provider and see if there are any people in private practice that you are able to see. So I really hope that you liked and enjoyed and got a lot out of our presentation today. Thank you so much for your time and have a great day.